Mayor Bottoms, thanks for the time. It's been a little bit of time since the shelter and at home orders for most people in the state have lifted. What are your thoughts about what you're seeing since then?
So I've been obviously disappointed. One, that the restrictions were lifted, but two, that it doesn't seem as if many people, heard anything past the lifting of the first part of the order. Meaning, sure, restrictions have been lifted, but the other part of the order was that people should continue to practice social distancing. They should continue to limit crowd sizes, and what I saw this weekend was very concerning. Obviously, it's a beautiful day. It was a beautiful weekend in Atlanta, and we'll have many, many more. But I just want to remind people that this virus is still highly contagious, and many people are still vulnerable, especially those with underlying health conditions. So we still have to continue to do all of the things that we were doing before the restrictions were lifted.
Were you surprised?
I actually was surprised, and I'm ashamed to say it. Maybe I should not have been, but I thought that people still recognize that this is a deadly virus. And when I went out, I believe it's on Saturday, I took my kids out to watch the flyover from the Blue Angels. I was stunned at the number of cars that I saw out and about. It looked like a regular May Saturday afternoon in Atlanta to me. And even more surprising to me was seeing the crowds of people who were gathering, not distancing themselves, not wearing face masks. That was surprising and disappointing.
Times are so different when you catch yourself looking at a picture or just being out at a place and you suddenly find yourself counting how many people and then counting how many face masks. What would your message be right now in terms of the significance of our personal choices?
People are still dying, and it's a conversation that I've even had to have in my own household, as I have four kids. One's 18. He's very antsy, ready to get out, and I'm constantly reminding him, and as I will remind the public, nothing has changed about this virus. People with underlying health conditions, whether it's asthma, obesity, diabetes, high blood pressure, all of the things that we've talked about repeatedly, nothing has changed. Those people are more susceptible. And what we've seen is that even people in perfect health are dying from this virus. It's really like playing Russian roulette when you go out and you don't take all of the precautions that we know help keep you from contracting COVID-19.
I know you're in very close touch with a lot of our state doctors. What are they talking to you about the timeline for when we might know the effects of what we're seeing here right now?
It will be the next 2 to 3 weeks. So, in very much the same way that when we took the very aggressive steps in closing down the city, there was about a 2 week period in which we would know whether or not what we had done was effective. Well, it's the same here. And reopening up the state, we'll know in 2 to 3 weeks what the impact is. And I've said this repeatedly, and I'll say it again. This is one that I hope to be wrong on. I want to look at the numbers in 2 to 3 weeks and see that everything's fine, and our numbers haven't gone up significantly, and that there aren't more people who are sick and dying in our state. But we won't know the answer to that. And I would just say, personally, I wouldn't want to be the test case for it.
Yeah, no question. I guess this would be a time where the right kind of peer pressure could be helpful. Do you hope that people will help keep each other and even businesses perhaps accountable for some of these choices and adhering to the executive order that still is in place for the state, but even the guidelines that are in place or at least recommended?
I hope so. And I recognize people are hurting financially. So for some people who have gone back out and gone back to work, this really is an economic decision, and one that they feel as if they don't have much of a choice in making. So that's one category of people. But then there's another category. I'll just call this group the thrill seekers, people who just want to go out because they can, and they want to soak in the sun, and they want to go about leisurely as if everything is okay. And it's not. So it's my hope that people will remember there are guidelines related to COVID-19, very specific guidelines: 6 feet of social distancing, wearing a face mask in public, making sure that you wash your hands. All of those things are still applicable. And I hope that as people venture out, to the extent that people aren't doing it, that, perhaps politely, without putting yourself at risk, you can remind people that they should be more cautious.
Some communities have made it a mandate to wear a face mask. Where do you stand on that? Would you like to see that be a mandate, or is it enough just to really implore people to consider taking that personal step?
It would be my desire that as people are in public, if there are crowds of 10 or more, or if you are in spaces that you cannot socially distance, that you wear face masks. And I'll tell you why. The other layer that we're having to deal with from the city public safety perspective, even in sending our officers in to break up large crowds, we're sending our officers into danger when people don't have on face masks. So it would be my wish that we wore face masks, and that there were some requirements with certain parameters. If you're out walking and there's nobody around you and you aren't in a large group, based on what I've seen and heard from the public health professionals, I don't think they would be necessary. But if you are in a large crowd that you can't separate and distance from people who may be in close proximity, I think that it would be in our best interest to have on masks.
We spoke last time about the way the virus is disproportionately affecting the African American community. And since that time, the CDC released a new report about just how prevalent that is. How closely is the city watching that? And are there ways that you are hoping that the response can alleviate that in any way?
Well, we're getting more data on the front end of this. Those questions were not being asked. So now that we are asking the questions when people are getting tested, we are gathering more data. But again, also reminding people that this is the South. So not only the African American community, but the South in general, we have higher numbers in all of these underlying categories. And so we'll continue to message that to people in the Atlanta community, especially the African American community. But this really is something that we should all think about as Southerners, because our obesity rates are higher. Our rates are of high blood pressure, diabetes, and asthma. And I sometimes feel as if I'm a broken record, but I don't think that I can say it enough, because we have to remind people that these conditions are very prevalent.
Yeah, no question. It is a message worth repeating over and over for sure. There was that Forbes article that was shared thousands of times. We heard a lot from viewers about it. It's since been pulled down. Forbes says they stand by the premise of the article, but there were some problems with the numbers. Your response on that, Mayor?
Well, my response is this: is that the underlying message is still there. Nothing has changed about COVID-19. And so whether it's you've increased your chances of 40% or you've increased them by 10%, um, nothing has changed about this virus. It's still a highly contagious virus. It is still overwhelming health systems across the globe. And most importantly, people need to be mindful of protecting not only their health, but the health of their families and people who they come in contact with. So I don't know the specifics about what Forbes has said in response to that article, but I think the overwhelming premise of it all was that this is still a very highly contagious virus, and it's still putting people's lives in danger.
If you could have, a moment, if you could be one-on-one with each Atlantan, what would that message be?
Stay home. We are a resilient people. We are a resilient community. We are a resilient city. This is a very tough time for our city, especially for people who are out of work and people who are struggling to make ends meet. But we need to get to the other side of this whole. And we can't get to the other side of this if we piecemeal our way out of this crisis. So I would just ask people to please stay home, give it a little more time. Allow us as a city to help you. If you are in need of services, if you are in need of assistance, if you are in need of food, I can't promise that we can do it all, but we'll certainly do the very best that we can. But the most important thing is the health of our community as a whole. And it's not healthy for us to go back to business as usual right now.
And you mentioned people needing support. I know the city has a number of new initiatives, ATL Strong, Strength and Beauty, Create ATL, and this is a significant day where Georgia can give back. Maybe now more than ever, our nonprofits always need that kind of support, but as they're helping more people, they need support in a great way now as well.
Absolutely. And it's Giving Tuesday. So we're asking people to support atlstrong.org. That we're working in conjunction with United Way to put money into the pockets of people who need help. Well, we are delivering meals to seniors and to our students. We're helping our homeless population. We're helping our creative industry. We're helping our cosmetologists and so many people. We're providing rent assistance. We're helping small businesses, so many people who are in need right now. And we ask people, if you are in the fortunate position where you aren't suffering economically, that you just dig a little deeper and share with those who are in need right now.
Yeah, there's no such thing as a small gift right now. Anything is significant.
Every penny counts. I was on our ATL Strong website earlier today. My 12-year-old wanted to give $100 from the money he saved from his allowance, and you can imagine a 12-year-old takes a lot of savings to get to $100. I went online. It was very easy to give, and I saw that there were donations that were coming in for $20, $26. Every $5, it matters, and it helps, and it goes a very long way.
Well, those are the moments that make a mom proud. That's really great. Mayor Bottoms, always appreciate the time. Thanks again so much.
Thank you.